Welcome to Trial Site News podcast series. We're excited to have Ron Bercume here with us today. Now, Ron suffers from hidradenitis suppurativa and is an HS activist who has created an amazing website which is dedicated to the education about this condition and giving those who suffer from HS a place to share their story. So, Ron, welcome.
Thank you. I appreciate the opportunity to be with you guys.
Yeah, the pleasure is ours. Now, before we deep dive into the topic today, I'd like our audience to get to know a little bit more about the man behind the story. So if you don't mind, tell us a little bit about yourself.
Sure. In short, I'm a 39-year-old male, obviously. I'm a father of three. I have three kids, a 19-year-old, a 13-year-old, and a 10-year-old.
Congratulations.
Thank you. My oldest being born and bred my second year of college. So that's why I have one a little bit young. Most people kind of scratch their heads at when I say that, so I want to clarify a little bit. So I have three kids. Let's see. I was formally trained and educated in graphic design in digital. Cool. Yeah. Went to college in 1999 at Rochester Institute of Technology, RIT, in New York State. Built a business through raising my children, and went through a marriage for the next 20 years. Did my best that I could within the industry. I actually had a very successful career up until 2015. But yeah, for the most part, I worked for a couple of decades within my own business as a graphic designer until 2015. If you fast forward today, honestly, I'm disabled. I'm on SSDI and disability right now, kind of coming over the cusp or over the mountain from my own healthcare crisis.
Yeah.
I hope to be back to work at some point, but I've been out of work since 2015. And these days, my focuses are what we're talking about today, my work with HS awareness for this disease. And as a patient, on a personal level, I build cigar box guitars. I have a little shop that I work at, and I ride my motorcycle too during the week. It's been a big part of my therapy. It's something else on a personal level, a hobby, you could say, or a craft.
Yeah.
That I'm completely obsessed with. So it's pretty much my kids, my guitars, my work with HS and social media and digital technologies, and that's about it. It's just focusing on continuing to fight through and end in quotes. My own health crisis that started in 2015.
Yep. Fighting the good fight. So on that note then, if you don't mind giving our listeners a quick rundown of when you first started showing signs of HS and when you were diagnosed and how that process took place for you.
Yeah, not at all. I believe it was 2 years ago, 2016, I had a short interview done and published to CNN Health. I believe you guys linked that up possibly below the podcast. So I'm going to refer to that and read from that in short and brief, if that's okay with you.
Yeah, sure. Go ahead.
Okay. So to quote a previous interview of mine published in CNN Health, it reads, I left home at 16 before graduating high school. I moved from upstate New York to a warmer climate. And in that warmer climate, something happened to me that had never happened before. What started as a boil-like lump on my thigh grew to be a 4 to 5 inch open lesion. Same thing happened on my other thigh, and eventually the same boil-like monsters appeared and multiplied on my pelvis. I didn't know what it was, and truthfully, I didn't want to know. My best guess was it was a bad case of herpes or an STD, which was anything I wanted to know or see. Let me kind of expand upon that STD comment right there. There's a lot of patients, because we don't seek care for so long, go without answers and proper treatment and diagnosis, that at some point we think we could possibly have an STD, right? And it's probably been misdiagnosed at times as that too. So I just want to put that out there. Me personally, I knew it wasn't because I'd been through a marriage and nothing ever happened to anybody else to kind of keep that simple.
Right.
But yeah, for a long time, didn't know what it was and thought it was some kind of mystery like STD or something really, really bad. So I just wanted to read a little bit from that CNN article because it's easier to pull it back up real quick. And it's the same story I've told several times, honestly.
Yeah, no problem.
Yeah. So if you fast forward now, that was when I was 16, 1996. If you fast forward now to 2019, 20 years later, I was just diagnosed back in 2015.
Oh, wow.
It wasn't until I was 35 that I learned what this disease was and was able to put a name to it. That's what I was kind of getting at after so long. I kept a deadly secret for a long time. I wouldn't talk to anybody about it. It's fairly common that I've learned since knowing a lot of other HS patients, reading a lot of stories, that we don't seek treatment for years, due to mental health implications and such. And if you can imagine, the shame, the embarrassment, and the other comorbid, the other coexisting conditions within mental health and others like severe depressive disorder that come with the territory. I'm very open. I even publish and blog and speak on my own healthcare and my own journey. So I suffer from depression, severe depressive disorder. I'm medically treated and seek counseling, and I love it, and I've been in it. That's another comorbid mental health condition, along with HS, that I've been dealing with untreated since a teenager.
Oh, wow.
Yeah. So how did it happen? How did I get diagnosed? Back in 2015, when I was 35, my disease activity was peaking. I finally decided to take a look on the internet to figure out what was wrong with my body, right? The same week, I had a rather uncomfortable situation giving a presentation to clients at work where I bled through my clothing.
Oh, wow.
It was embarrassing, pretty traumatic. And it was probably the sole reason after so long I decided to do something and look and figure it out. I quickly discovered HS through a Google search for content and images. I pulled a couple things up, and it's those of us who have this know exactly what we're looking like. So it was it wasn't even an aha moment. It was just fairly organic, if that makes sense.
Yeah.
I also discovered support groups and HS patient populations by the thousands, just like myself, on Facebook. Most of us sharing a similar story. I would discover at the time, and you guys probably hear it now through speaking with other patients and stuff. There's a lot of commonalities, right?
Mm-hmm.
So I quickly and aggressively started to pursue my own healthcare and treatment after never seeing a doctor for this condition or anything else ever. I didn't have any existing medical records or histories. When in those first weeks, I saw a dermatologist for the first time for a proper diagnosis.
Well, and it's interesting that you mentioned that, because from some of the people that we've also interviewed that have had HS, and just from personal experience from people that I've spoken with outside of here at Trial Site News, it does seem to be a common theme, and it's tragic. Some of the people I've spoken with actually had shame about it, where they thought, oh no, there's something wrong with me, and which is part of what we love about what you're doing with your website, helping people see that they can talk about it, and that is amazing, and we love what you do there. So we normally hear about the 3 stages of HS. Do you think there are 3 stages or more?
Well, when HS is defined as a 3-stage disease, it's only done so using a system that's been used for a very long time within dermatology called the Hurley staging system. Mm-hmm. The Hurley system has been used widely because basically there's been nothing else until fairly recently. I would just add, since we're doing a podcast for Trial Site News, outcome measure instruments, OMIs, for clinical trials with global consensus only been recently planned for and under development due to an organization or initiative called HS Core Outcomes Set International Collaboration, or HISTORIC for short. It's a global effort to reach consensus on how best to measure physical signs of HS reliably within clinical trial setting, right? Mm-hmm. Hurley's diagnostic criteria is very simple, and as such, it unfortunately doesn't serve the patient and the complexities of this disease very well, right? Over the last few short years, awareness has been growing for this disease within both patient population and industry. There's been several new staging systems either being used or being developed or been proposed to better serve us HS patients through more accurate and in-depth evidence-based medicine, and that should at all times fall under a global consensus in practice. For example, here's several of them. The redefined Hurley staging system, the Hidradenitis Suppurativa severity score system, for short IHS4, the HS Severity Index, for short HSSI, the Sartorius HS score, and the HS Physician Global Assessment Score, HSPGA for short, excuse me, it's a long word, all of which are an attempt to better define clinical practice, diagnostic criteria, and our treatment for HS patients beyond the simplicity and shortcomings of the Hurley system. Mm-hmm. ultrasonography is becoming more widely used.
Mm-hmm.
It's very much needed for HS patients, as these methods and technology can provide for better physician clarity. They help to discover non-clinically evident disease that takes place deep below the skin that a lot of physicians, unfortunately, to say it nicely, will overlook.
Hmm.
Two sonographic scores, the sonographic score of HS for short, SOSH, and the ultrasonographic HSPGA have been used to a pretty limited degree so far within some academic reporting and publishing.
So among those that you just mentioned, what would you think is the most effective? Because you mentioned that sometimes, say, under the skin, it gets missed. Yeah.
Well, ultrasound is a critical diagnostic tool. Categorizing it within how it's used within HS pathology and treatment is kind of a different story against some of those names that I just read. Looking to the academic publishing recently, maybe 2018 and 2019, where they've put some of these into practice. From what I've seen, sometimes it's a combination of two or three of them.
Yeah.
Or a combination of the staging systems on two or three of them, along with the ultrasonic kind of technologies.
Mm-hmm.
I'm going to reserve any kind of opinion on which is the best so far, because I think the jury's still out, and hopefully someday soon there'll be a single staging system that can reach and have that global consensus, right?
Yeah, it'd be nice to have a standard, especially considering the different reactions when I've spoken to different people have had it. So yeah,
it seems like industry as of late has been more concerned with shoring up, being very well aware of the lack of awareness and the lack of treatment and research that's out there for this orphan disease. They've been more focused on addressing the issues within clinical trials than they have staging systems and in the office with patients, unfortunately. It'd be nice to see them tackle it all at one time, but unfortunately, industry is industry, and there has to be money where there's money to be made, right?
True. Now, you mentioned, since 2015, you've been in a constant battle with HS. Have you had any luck with putting your HS into remission through various ways? For example, diet, lotions, soaps, or low stress, etc.
Yeah. Well, personally, and again, living with disease now for over 20 years, I have experienced remission, but I haven't personally experienced remission through any rhyme or reason. I've experienced periods of remission, not due to any specific effort of mine or through healthcare.
Mm-hmm.
For example, for about the last year, my disease activity has been pretty low compared to the previous 3 years, and I'm not medically under any treatment. We could say this disease has a mind of its own.
Now, what about surgery? Have you had any to help treat your HS? And if so, how has that experience been for you? Did it help? And were the doctors respectful and understanding of your pain?
Yeah, got it. Yes, about a year ago, I went under for what's called a wide excision surgery. It was performed by an excellent wound care surgeon that I ended up connecting with through my local hospital network. He did an amazing job with the procedure. It was, not to go into too much detail, but it was my right buttocks cheek. I had a very severe area that had been left untreated, like most HS patients, for over 16 years.
Wow.
It's something that developed. If I onset 16 on my thighs and my pelvis, it was a couple of years later that the beginning of what this gentleman did the procedure on started. He removed a large majority of the tissue in the area down to the muscle layer. Recovery was fast, and to this day, it's been a year. I haven't experienced any reoccurrence, nor do I expect to, because he did such a great job.
That's incredible. Now, for those that don't know what a wide excision surgery is, if you'd like, would you care to expand on that?
Oh, it's well, don't Google it.
Just caution ahead.
Yeah. How do I best explain this? It's where a large connected area of the skin again, maybe even down to, depending on the case, down to the muscle layer, is removed altogether. So if HS disease activity presents itself, and it does differently from patient to patient, but the most common areas are where sweat glands and hair follicles are. So you would imagine seeing disease activity in the armpits and in the growing and in the buttocks in certain areas, right?
Yep.
So wide excision surgery is where the surgeons come in and they remove a whole area that's compromised by this disease activity versus like a local or a smaller area of treatment, if that makes sense. I'm not sure I explained that.
No, that seems pretty good, yeah.
Oh.
It's amazing to me how much you're able to cope with that. And speaking of pain, how have you treated your pain? And if not, how have you coped with it or pushed through?
Yeah. Well, I'm not, and I've never been under pain management or treated for it. To quote that CNN Health interview again, if I may, it reads, "I'm not exaggerating when I say it's the worst physical pain imaginable. Quite literally, a huge pain in the butt. I essentially get 2-inch deep festering open sores in these areas. It feels like a sharp and white hot knife is cutting into my skin and stuck there. And unfortunately, there's not much I can do about it." Honestly, I'm, right here in this conversation, it's not something coping is not something I've thought about a lot. I'm not sure I can effectively answer how I have coped with the pain for so long, the compromised areas of my body that have been affected, both physically and mentally. It's just been part of my life and reality, kind of like the air you breathe. So I'm personally someone who has never really done anything, I guess. It doesn't make any sense, I know, but I really can't grasp how I've had any kind of mechanisms or process to cope with the pain from this disease other than letting it run its course and draining and treating myself, for lack of a better way to explain it.
Yeah. Wow. That is it's amazing though that you have been able to. Now, switching gears here, have you found the doctors and specialists you've seen about hidradenitis suppurativa to be compassionate and helpful?
Well, it's a complicated question, and in my story, I've had my share of traumatic experience with annoying and unhelpful and neglectful physicians. I'll just say over these past 3 years since I started seeking treatment within healthcare for HS and other comorbid conditions that I've seen, or I'm still under the care of 17 different physicians. And I say that now thinking back to my SSDI application where you have to list your doctors and your physicians, and I had a total count of 17.
Wow.
There's just a handful of them today that are part of my care team, and they've been instrumental in my ongoing long-term care and treatment. It took a lot of good fight through the system because, as I mentioned in the beginning when I went through, I didn't have any medical records. I didn't have any histories. And when you walk into a doctor's appointment or an office and you say X, Y, and Z, and this, and this, and this, and this, and this is wrong, and please help me. And they need and want to come to their own conclusions as physicians and doctors, hopefully through evidence-based medicine. Sometimes they're not always so compassionate with their listening. Especially when you're a little bit manic and going through a breakdown, right?
Yeah.
So it took some good fight to get to the system. And I finally found an amazing PCP, my family doctor, who's been instrumental in helping to coordinate my care and keep things straight, and is totally open. Someone as proactive and aggressive as I am and have been within my own care, managing medical records, for example, to make sure everything's done properly and all that good stuff, things that I advocate for other people within people with disabilities and people with HS. My history of advocacy. So right now, for the most part, I'll just focus on. I don't want to go into detail about the bad experiences, if that's okay with you. Just focus on the good one, like we talked about my latest surgery and how well that wound care surgeon had done for me. But there was definitely a series, especially maybe in that first year, where I went through several, if not many, very, very disheartening doctor appointments.
Well, we're all sorry to hear that, and that does seem to be, I know doctors often get overworked, but, it's that looking at them and every patient as a person, not just the next, patient on your list.
A 15-minute PCP appointment isn't going to do it for a new HS patient.
No, you have to spend the time. Something as a whole we need to work on for sure. So on that same vein, have you participated in any clinical trials for HS?
I'll just precursor that by saying, because I publish on this disease, both personal accounts and narrative storytelling and academic data, that I've spent a lot of time with clinical trial data and journals to be aware of what's been out there, what's coming out and such. So I like to stay on top of that stuff, and it's something I have a decent working body of knowledge of. Personally, there was a circumstance back in 2015 when I was flown to Germany as an HS awareness activist and advocate to do some film documentary work, where I spent time with other patients, interviewing other patients and such. There was also I was also unofficially treated with a procedure that involved light therapy. It did provide for really excellent short results, but it's not something I continue with, having to come back and living in the United States.
Gotcha. Shifting a bit here, what have you found to be your biggest triggers for HS? And for those that don't know, triggers would be something that causes the autoimmune system to flare up. So for some people it might be diet, for some people it might be things they touch. But yeah.
Very complicated dynamic, right? And I know many patients try to identify what their triggers are. They try to. I won't go into my opinion in great detail, but I'll just say that I have no identifiable triggers that can be backed up in any factually reliable circumstance. I've experienced periods of remission over my 20 years where my health's been bad, and I've experienced extreme disease activity when my health's been good. There's not one single catalyst that's pushed it either way for me personally.
Makes sense. Now, if there was one or only one piece of advice you could give to those suffering from HS or with HS, what would it be?
Maybe one last quote from my CNN article. It reads, most importantly, don't be afraid to share your story. Fight the stigma. This article is titled, I'm done hiding anyway, right? So it says, I'm done being ashamed of this condition. I'm done hiding. And I very much hid for 20 years, and we all do, right? I believe one of the first nonprofit organizations, if I'm not mistaken, in the United States was called Hide, for example. HS for some people is and should be something very private, due to the stigma around severe skin disease and the mental health implications that we talked about a little bit that are so often related. It's no surprise that most of us do not share it with another soul for a very long time. And when we do, are very apprehensive still to do so. But as I see it, part of the historical neglect of this once thought to be a rare disease is because it's been hidden in the shadows for so long. The only way to raise awareness and as a result provide for better treatment for us as HS patients is to talk about it. So for those who make the decision, who can decide to sacrifice their own privacy and can be open about the disease, it's not for everybody. I'm not pretending. I've never tried to push it on anybody to share their story or anything. But those who can or are willing to, I would encourage them to share the story with as many people as possible.
Yeah, I agree. Now, is there any daily skin routine care that you would suggest for HS patients to follow?
There's a bunch of stuff I could rattle off. It's something that's often like home care remedies and such. It's very much topic of conversation in our support group networks across social media and even in person. I've been blessed actually to sit in person support groups here on Facebook. But for the most part, trying to be a responsible advocate and someone who publishes for the sake of free-flowing information, data, and ideas. I tend not to recommend treatments or be opinionated about anything. It's kind of a golden rule of mine because this type of decision-making should be between themselves and their qualified physicians.
Now, this is a common question because the itching is a big deal for people. What suggestions do you have for those who suffer from their wounds itching?
Honestly, Adrian, I have to put that right where I just left off that last question, treatments would be required to reduce or prevent itching, no matter on what level, whether it's home-based remedies or it's something prescribed by the doctor. As far as I'm concerned, I tend not to recommend treatments or care for any patients. I will often share through personal experiences what's worked for me in the context of my own storytelling. Yeah. Or if there's another story out there that worked for someone, I might point someone in that other direction. That doesn't mean by any means that within our support group networks where people have conversations daily about these things, that doesn't mean that within the context of the technology we use to provide for patients that these conversations aren't had. They very much are all the time. But it's not something myself, as a founder of an NGO and a growing organization, I'm not a doctor, right? Yeah. I'm not a physician. I can sit there and quote and cite citations and link up medical history and journals for the last 100 years on this disease. But, yep. but personally, I don't recommend treatments for other HS patients.
Well, and that makes sense. So no, I hear you. Well, Ron, thank you so much for talking with us today. We love your passion about this issue, and I know that your website and what it means to a lot of people, and it's amazing what you're doing there. So thank you for all your hard work on this issue.
Oh, thank you.
Yeah, no, it's our pleasure. And now for those of you in the audience interested in learning more about Ron and his work, you can visit his website at hsawareness.org, which will be provided as a link in the description below. And you can check out his private group on Facebook as hashtag HSGlobal. And all other links will be provided in the description below, including the CNN link that you mentioned earlier. And you can also find Trial Site News on Instagram, Twitter, Facebook, and YouTube. And the links will be provided in the description below as well. So thank you for joining us today, Ron. It was a pleasure to have you here.
Thank you so much for the opportunity and having me, and my thanks, if I can speak for other HS patients, for the work you guys do on publishing on HS awareness and clinical trials, and in an attempt to better serve the world, to better serve us HS patients. So bless you guys.
Well, thank you. Well, we appreciate that, but the real work, that's the stuff that you're doing. It's amazing, and we're rooting for you, and we'll definitely keep following your story as it progresses.
Oh, you're too sweet. Thank you.
Yeah, anytime.